DVT. Deep vein thrombosis, DVT, is a blood clot that forms in a deep vein, usually in the leg. Most DVTs happen in your lower leg, thigh or pelvis, but they also can occur in other parts of your body including your arm, brain, intestines, liver or kidney. The incidence of DVT is on the rise and it is estimated to affect around 2 in 1,000 people every year. The figure rises to 8 per 1,000 in those aged 85 to 89 years. DVT occur 50% of the patients after prostatectomy and 1/3 of the patients after a myocardial infarction, heart attack. Over 60% of all people dying in hospital and examined post-mortem are found to have a thrombosis in a leg vein. Women are greater risk of DVT than men. Each year in the USA, more women die from a pulmonary embolism following a DVT than from breast cancer. As many as half of those who get a DVT in their legs develop symptoms of intermittent leg pain and swelling that may last months to years. These symptoms are called post-thrombotic syndrome and can happen because of damage to the valves and inner lining of your veins leading to blood pooling more than it should. This increases the pressure inside your veins and causes pain and swelling. Common symptoms of DVT include pain or swelling in one leg, warm skin over the affected area, red or discolored skin, discoloration, cyanosis of the leg due to lack of oxygen, congested leg veins, slight fever, leg ulcers known as venous stasis ulcers, changes in skin texture or skin that feels tender to the touch, abdominal pain or flank pain, when blood clots affect the veins deep inside your abdomen, severe headache, usually of sudden onset, and/or seizures, when blood clots affect the veins of your brain. Some people don't know they have a DVT until the clot moves from their leg or arm and travels to their lung. Symptoms of acute PE include chest pain, shortness of breath, cough with blood, lightheadedness and fainting. There are several risk factors associated with DVT, including a family history of blood clots, being over 60 years old, obesity, smoking, cancer, recent surgery or injury, prolonged sitting, such as during a long flight or car ride, hormonal changes due to birth control pills, pregnancy, or menopause. Pulmonary embolism, PE, is a serious and sometimes life-threatening complication of DVT. PE occurs when a piece of the blood clot breaks off and travels to the lungs, blocking blood flow. Pulmonary embolism, PE, is a serious condition in which a blood clot blocks one of the blood vessels in the lungs, causing reduced blood flow and oxygenation. It can lead to shortness of breath, chest pain, rapid heartbeat, and in severe cases, sudden death. PE is often caused by clots that travel from other parts of the body, such as the legs, to the lungs. Risk factors for PE include immobility, surgery, cancer, pregnancy, and certain medical conditions. Diagnosis. Diagnosis is typically made through imaging tests such as CT scans or pulmonary angiograms. The treatment involves anticoagulants to prevent further clots and dissolve existing clots. DVT can be caused by a variety of factors, including injury to the veins, slow blood flow, and increased blood clotting. Certain medical conditions, such as cancer, heart failure, and stroke, can also increase the risk of DVT. Deep vein thrombosis, DVT, is the formation of a blood clot in the deep veins, most commonly in the legs. It can lead to pain, swelling, and redness in the affected limb, and in severe cases, the clot can break off and travel to the lungs causing a pulmonary embolism. The following are some of the causes of DVT. 1. Age. As you get older, your risk of DVT increases. 2. Obesity. Excess weight puts added pressure on your veins and makes it harder for blood to circulate. 3. Immobility. Sitting or lying down for long periods of time, such as during a long plane flight, increases your risk of DVT. 4. Medications. Certain medications, such as hormonal contraceptives and hormone replacement therapy, can increase your risk of DVT. 5. Pregnancy. Pregnant women are at increased risk of DVT due to hormonal changes and increased pressure on the veins. 6. Surgical procedures. After surgery, you may be at higher risk of DVT due to immobility and changes in blood flow. 7. Serious illnesses. Certain medical conditions, such as cancer, heart failure, and stroke, can increase your risk of DVT. 8. Family history. If a close family member has had DVT, you may be at increased risk. 9. Varicose veins. Veins that are enlarged and twisted can increase your risk of DVT. 10. Hypercoagulability of the blood. Some people have a genetic predisposition to blood that clots too easily, increasing their risk of DVT. 11. Inherited abnormalities of the blood. Certain inherited conditions, such as factor V Leiden mutation, can increase the risk of DVT. 12. Having an autoimmune disease, like lupus, vasculitis or inflammatory bowel disease. 13. Having a central venous catheter or pacemaker. 14. Having COVID-19. DVT is present in 5% of the population. Diagnosing deep vein thrombosis, DVT, is important to prevent complications, such as pulmonary embolism, PE. The following are some of the diagnostic procedures used to diagnose DVT. Doppler ultrasonography. Doppler ultrasonography is a non-invasive test that uses sound waves to create images of the veins in the legs. It can help to identify the presence of a blood clot and determine the location and size of the clot. Venography. Venography is a diagnostic test that involves injecting a special dye into the veins and then taking X-rays to visualize the veins. It can help to identify the presence of a blood clot and determine the location and size of the clot. Blood tests. Blood tests, such as a D-dimer test, can help to diagnose DVT by measuring the levels of a substance that is released when a blood clot breaks down. Computed tomography, CT, scan. A CT scan is a diagnostic test that uses X-rays and a computer to create detailed images of the body. A CT scan can help to identify the presence of a blood clot and determine the location and size of the clot. Magnetic resonance imaging, MRI, scan. An MRI scan uses magnetic fields and radio waves to create detailed images of the body. An MRI scan can help to identify the presence of a blood clot and determine the location and size of the clot. In some cases, more than one test may be needed to diagnose DVT. Treatment options for DVT include anticoagulant therapy, such as warfarin or heparin. They help to prevent new clots from forming and existing clots from getting bigger. Thrombolytic therapy, which uses medication to dissolve the blood clot. Clot extraction, a procedure in which a catheter is inserted into the affected vein to remove the clot. Anticoagulation therapy is a treatment used to prevent blood clots from forming or growing in people with deep vein thrombosis, DVT. The goal of anticoagulation therapy is to reduce the risk of DVT complications, such as pulmonary embolism, PE, and to prevent the recurrence of DVT. The following are the types of anticoagulants used in the treatment of DVT. Warfarin. Warfarin is a commonly used anticoagulant that works by blocking the action of vitamin K, which is needed for blood to clot. Warfarin is taken orally and requires regular monitoring of blood levels to ensure that it is working effectively. Heparin. Heparin is a fast-acting anticoagulant that is usually given intravenously in the hospital and then switched to an oral anticoagulant. Direct oral anticoagulants, DOACs. DOACs are a newer type of anticoagulant that works by directly blocking the activity of certain clotting factors. They are taken orally and do not require regular monitoring of blood levels. The length of anticoagulation therapy depends on several factors, including the severity of the DVT, the presence of underlying medical conditions, and the risk of recurrence. In general, anticoagulation therapy is continued for at least 3 to 6 months. And in some cases, it may be continued for life. It's important to talk to your doctor about the potential benefits and risks of anticoagulation therapy, and to follow all instructions carefully to ensure that the therapy is effective and safe. Regular monitoring of blood levels and close monitoring for side effects, such as bleeding, is also important. Compression stockings. Graded elastic compression stockings to either improve or completely get rid of leg swelling could be recommended. Damage to the small valves inside your veins often causes this swelling. You may also have swelling because the DVT is blocking blood flow in your vein. You wear most compression stockings just below your knee. These stockings are tied at the ankle and become looser as they go away from your ankle. This causes gentle pressure or compression on your leg. Some people need to wear these for 2 years or more.